Hello and welcome everyone. Today I want to talk about something that comes up a lot with many of my clients, and that is bracing, especially back braces, SI joint braces, and knee braces. And if you've ever wondered, could I wear one of these braces and maybe it will help me with my back pain? Or maybe you're wondering, is this even helping at all? Is this doing anything, or is it just making me weaker? Or should I maybe be focusing on core strength instead so I can really get to the root cause of why I'm experiencing this pain? So these are all important questions that I'm going to answer today. And that really depends on what's going on with your body. So we're going to dive into that today. And I'm going to talk a little bit about the difference between external support, which is a brace, and internal support, and how you might know which one that you need. If we haven't met yet, I am Jenna. Welcome on in. And I help people who often feel overlooked by the medical system get out of pain by using a holistic approach that includes movement, mindset, and healing through food. So I'll first start off by sharing a little bit about my own story. So when I was in my early 20s, I discovered yoga and I was obsessed. I started practicing all the time, 2 classes a day. Those 2 classes a day meant that I was doing yoga 3 hours a day. I was also already very flexible. I didn't know at the time that I actually was already hypermobile. So all of that stretching that I was doing in those yoga classes felt amazing because I was already really good at it. And my hypermobility that I already had was being praised. So that led to overstretching my ligaments. I then was a professional dancer, so the rigors of that, the positions that I would put my body in would injure my ligaments as well. And I also had a lot of snowboarding injuries where I would fall on my butt. I broke my tailbone a couple times, and I had a lot of falls that most likely tore some of those ligaments in my pelvis. So needless to say, I had a lot of SI joint pain from my mid-20s on. And I had a number of very acute bouts of it. One time I remember trying to just walk down the street, and I could only walk for about 2 minutes before I had to sit down because I felt like my pelvis was literally falling apart. So at that time, I did try to use an SI belt to stabilize my pelvis, and it did not help because that was not getting to the source or the root of what was causing that pain. But recently, I have been doing a lot of swimming in the ocean. I moved to Southern California, so I've been swimming a lot and body surfing. So I fell body surfing a number of times in a big wave, and there was one particular fall that I remember was very scary, and I got up from that thinking that I might not be able to walk, but luckily I was okay. And then right after that, I ended up going backpacking, putting a lot of pressure on my back and on my spine. So the combination of those things, I believe I re-injured my ligaments in my pelvis. And that led to a lot of pain, a lot of instability in my hips. I also have scoliosis, so that contributes to it as well. And that led to another very acute bout of SI joint pain, but different than the last one. But because I had already tried the SI belt in the past, I figured, okay, it probably is not going to work for me. So I tried all the things I know how to do for myself, that I do in my programs with clients: nutrition, therapeutic exercise, physical therapy, chiropractic, massage, acupuncture. I really tried everything, and there was really not much that was helping my pain. And so I just thought, okay, I will give this SI belt a try again. I'll give it one more chance. And it immediately gave me relief. And so that means that the issue is actually coming from the ligaments in my pelvis that are supposed to hold your pelvis together. Our SI joints are really only supposed to move a tiny bit, like a few millimeters. There is supposed to be some give and some movement in there. We have more movement as women than men, and that is for childbirth, so our pelvis can expand. But the problem with that is that you can expand too much. Your ligaments can be too lax, and they can also be injured. They can be torn. We have a lot of ligaments that run down the back of our pelvis that attach our sacrum to our ilium. That's why it's called the SI joint, sacroiliac joint. And if those are loose, one side can be hypermobile, so it's moving too much. And then the other side can be moving not enough, hypomobile. And that's where it gets really complicated, because if we don't adjust the exercises we're doing, the movements that we're doing for that issue, one side being moving too much, the other side not moving enough, then we're probably not going to find much relief. But what the SI belt can do, and what it has done for me in my case, is it will help to create stability in the pelvis so those ligaments can heal. It will help to do the job that those ligaments are supposed to do, so then your body can actually heal. And so that is one instance of why you would want to use one of those belts. But we can also be improperly using these belts. We can be putting them on wrong, tightening them too much. And so at the end of this live stream today, I'm actually going to show you how to put one of these belts on and how to do it properly. And the other thing is, like I said before, if we're not addressing the underlying issues of why you're having this issue, why you're having this pain in the first place, like core weakness, maybe poor alignment, unlevel hips, so one hip is higher than the other, one leg is higher than the other, that's going to shear not only your SI joints, but also the lumbar vertebrae in your spine. That could be causing back pain. And it also really can come down to a nervous system level. Are we stressed all the time? Are we in fight or flight constantly? Is our body able to do the healing that it needs to do? So just yesterday, as an example, one of my clients came in and she was wearing a knee brace and had one of these SI belts. This is what it looks like right here. Like I said, I will show you at the end how to properly use this and how to put it on. But after doing a movement assessment with her and reviewing her symptoms, it was clear that the problem wasn't coming from her SI joints. It was coming from her back, from her lumbar spine. So she was using the wrong brace. And if she wanted to try a brace, she should have used a lumbar brace that goes all the way around your lower back. And so these braces also can give us this false sense of security while possibly increasing muscle tension, and then keep us from really addressing the real root cause of our pain. So like I said before, you want to be able to take a good look at that, and you also want to make sure that you're not wearing the wrong brace. So that's also really important. So I want to talk a little bit about the difference between external support and internal support and when each is needed. So external support when it comes to a brace is going to be one of these guys. So this is really helpful when it comes to a short-term flare-up, so that you can give your body the chance to heal. You can give it that support. Or for acute injuries, like in my case where I sprained or injured the SI ligaments, or pelvic instability. So that helps it also feel safer for your body to move so that you can retrain your movement patterns. So that's external bracing. Before I go to internal bracing, I just want to welcome everyone who has jumped on the live stream. Hello, Iris. Thank you for joining. And if you have any questions, feel free to pop that in the chat. And also let me know where you're joining in from today. So internal support is learning how to activate our deep core. Internal support comes from within. And when it comes to our deep core, that would be our TBA, our transverse abdominis, and our pelvic floor muscles that help to create that support and stability to protect our spine. The transverse abdominis wraps around our torso like a corset and pulls everything in to help stabilize the spine, and also plays a role in stabilizing the SI joints. So if you want more information, if you want to watch a video on how to activate your core properly, I've done many live streams on this in the past, so I'm not going to dive into it today because I want to get to some other things and we only have so much time. But if you're interested in checking out one of those videos that I've done, then go ahead and comment core below and I will send you the link to that. So the next thing you want to be working on to build your internal support is building body awareness and posture and movement habits that help to support your body. So especially if you're having back pain, of course, posture is so important. So we want to look at, well, what position am I holding my body in throughout the day? And is a back brace really going to help me with that? Or do I actually just need to adjust my position and use my own core muscles? So that transverse abdominis muscle that I was talking about, it's like nature's back brace. So it's actually there to help support our spine from within. And when we can learn how to properly recruit it, then it can actually do the job that a back brace is trying to do. It's going to do it way better. So we want to make sure that we have that muscle working for us. We also want to make sure that we're releasing unnecessary tension and guarding in our back. So overworking muscles in our lower back can cause a lot of tension and pain, and a back brace is not going to help with that. It's not going to help to turn off those muscles unless you have a job like you're doing a lot of heavy lifting, and that's why your back is hurting. That is one case where a back brace would be really supportive, because with that heavy lifting, it's going to help to support your back. But again, you want to be able to learn how to activate and wake up those sleepy core muscles so that they can also do that job, because that's their job. That's what those muscles are designed to do. So we want to make sure that they're working for us. Welcome, Vicky. Nice to see you today. Go ahead and pop in the chat if you can relate to this topic today. And if you have explored using a brace, let me know. So lastly, we want to rebuild internal stability from a place of safety, not fear. So this is another thing when it comes to being in a lot of pain, whether you're in acute pain or chronic pain, is we can have a lot of fear about moving our bodies, because we think that if we move in a certain way, that's going to create pain, because it has in the past. And research has shown that when we anticipate pain, we create more pain. So again, it all comes back to that core support. We want to have that support from within, learning how to activate, strengthen, and use nature's back brace that was given to us for free. We don't have to buy it on Amazon. It's right there in our own bodies. But like I've been saying, a temporary brace to teach your body that it's okay, that it's safe to move, that it doesn't have to guard so much, can help those muscles to relax. So this is where it becomes important to experiment with this. And, you just want to see if it works for you or not. But I would recommend, before you start to do bracing, to first begin to work on strengthening your core. Make sure that all the muscles are firing properly. That's really important to help us with our long-term health, especially when it comes to back pain. And then if that's still not quite working for you, well, then you can try using a brace. And that's what I did. I tried actually for a year, all these other therapies, and I wouldn't recommend waiting that long. But again, because I thought that this didn't work for me before, maybe it's not going to work this time. And this is why I wanted to do a live stream on this today, just to talk about it a little bit and to build awareness around. There's no shame in needing to use one of these. If it works, it works. But again, we just don't want to rely on these devices. We want to be able to find that strength from within. So this is a big part of what I do with my clients, both in person when I work with clients and in my online group coaching program, Thrive Beyond Pain. Because if you're struggling with pain or an injury for a really long time that's just not going away, it could be that the underlying reasons of why you're in pain is beyond just not doing the right exercises. It might be that your nervous system needs some more support so that you can calm the system so that your body can truly heal. Or it may be that we want to look at how to nourish our bodies with food so that we're not creating more inflammation in our body through our diet, through sugar and highly processed foods. So I help people to retrain their bodies and their brain to feel safe, strong, and supported again without relying on a brace forever, because nobody wants to have to go out at night with a brace on and do everything, all of their activities, going to the grocery store, doing everything with a brace. You want to be able to just live your life freely and not have to rely on these devices, right? So let me know if this resonates with you, if you've had this experience before with bracing. So let's go ahead and take a look. Like I said, I was going to show you how to properly put one of these braces on. So I really like this one that I got on Amazon recently. I'd never seen one like this. It's a pretty new design. It's called Jomeca, Jomeca. I can put that in the comments below. But again, this one is for SI joint pain, not for low back pain, unless your low back pain is coming from your SI joint pain. And this is why a movement assessment like the one that I do could be really helpful for figuring out which one it is for you. But I'm going to show you this. So what you do is, this particular one, you can use these amazing dials. These are so cool. So it has these dials that increase the tension. So you want to make sure that you release those first. Most SI belts have this band that you pull to tighten it, not these little knobs. So that's why this is unique. Now, where you want to put it is if you go ahead and lift your leg up and flex your hip like this, then that is where your, pelvis basically ends right there. So it's going to go way lower than most people would think. And I guess it's not helpful that I'm wearing all black, but hopefully you can see that still. So I wanted to go over my SI joints. If you don't know where your SI joints are, if you take your hand and you go to the back of your pelvis, and you feel for a little bone that's sticking out, and if you're having SI joint pain, that bone is probably going to be sticking out because the joint is not congruent. That's one of the reasons why you're having pain. Low back pain is misdiagnosed all the time when it's actually really coming from your SI joint. So the first thing I always ask my clients when they say they're having back pain is point to exactly where you're feeling it. And 80% of the time, it's actually their SI joint, not their low back that they're feeling. So if you're feeling pain in the middle of your spine, that's coming from your low back most likely, but lower down and a little bit more, like an inch or two lateral to the side, that's your SI joint. Okay, so I'm going to put this on. Now, tighter with these is not necessarily better. You don't want to wrench it down as hard as you possibly can, because that's going to really change the way that your muscles are firing, and that could, again, cause you more pain over time. So then I'm going to go ahead and turn these little dials here and tighten it. So most SI belts, you're going to pull wrap them around, and that's how you tighten it. But with this cool device, I just crank these on down and then it tightens it for me, which is also cool because, like I said before, with the SI joints, one side is hypermobile, one side's hypomobile, too much movement, too little movement. So you could actually adjust more stability and support on the side that has too much movement. All right, and that's it. And then I'm just gonna go about my day with this on. So for me, I get the most pain when I sit down because sitting in most chairs will tuck the pelvis under, which puts pressure on your tailbone and pressure on your sacrum. And that is going to pull on those SI joint ligaments. That's why when you have SI pain, sitting is usually one of the most uncomfortable positions that you can be in. And so this helps to create the stability and the support so that when you sit down, those bones are not going out of alignment, but they're staying in a more congruent place. And that's what we want, is congruency with all of our joints. So if you think that this might be something that's going on for you, try this out, see how it feels. And the best way to know if this is going to help support your body or not is, of course, to just try it yourself. But you do want to make sure you know, like I said, where is this pain coming from? Is it my low back? Is it my SI joint? And so if you would like to do a movement assessment with me, we can do that. And I do those for free. We just jump on a 30-minute call and we can do our reset and relief call together and figure out what is going on with you, and then create a personalized plan to map out so that you can really see how you're going to get from where you are now. Maybe you're struggling with pain or an injury, you're really not sure exactly what to do, what exercises to do, how to support yourself, and we can help you find your way to where you want to go. So you can go ahead and comment Thrive below if you'd like to take me up on that, and I will reach out to you. And I hope you have a beautiful rest of your week and that this was helpful. Comment below if you have any questions about belts or these SI belts or lumbar support belts, and let me know if you've tried this before and has it worked for you in the past. Okay, I will see you next time. Bye.